Tell me, can you just go back to that first question that I asked about the 80% finding? How exactly did you come to that?
So the way that we calculate that is to look at the total number of people who have died as a result of COVID. And the basis that we use for that is the excess mortality that's published by the South African Medical Research Council. What that shows at the moment, as we speak, 238,000 people died over this period of COVID in a very unusual pattern. So many more people than you would usually expect when there's no COVID around. We're assuming 90% of those people died as a result of COVID. And what we do then is to say what we know about the mortality rate, the infection fatality rate of COVID. With that knowledge, you can work back. And if you do that sum, what you find is that between 42 and 48 million of South Africans have already had COVID as we speak.
Emile, just explain, does this also have to do with the fact that some people would probably be asymptomatic? They don't display any symptoms and therefore they don't know that they actually have it?
That's right. That's exactly right. I mean, that's why it's an estimate, because we simply don't know. Not every person who gets COVID gets tested, and many people have COVID without even knowing. And that's the case across the world. So in every country in the world, nobody knows exactly how many people have had it. However, what you can do is you can check against seroprevalence studies. So if, for instance, there's a study that tests whether people have antibodies in a particular area, or if it looks at blood samples from blood banks. And what we have found in the past is whenever those studies come out, it's pretty much consistent with the numbers that we get in this way that we calculate it now. And we find that, when those tests are done, also bearing in mind that not every person's blood gets tested, and that antibody tests don't happen for absolutely everybody. But based on the samples and the prevalence that one sees there, you can see that it's a reasonable estimate.
So then, I guess then the only way we can fight this is by getting vaccinated, because if people are walking around not knowing that they have the virus, they could be spreading it. I mean, information keeps changing every time we learn about COVID-19, because of course it's new for all of us. So every time we think we know something, something else comes up.
Yeah, so I think that's exactly right. I think that, maybe the way to look at it is there's two ways in which you build up resistance to an infection. One is by being previously infected. The other one is vaccination. Now, when we look at the data that we have, bearing in mind that at discovery we see when people get tested, we see the result, we know whether they tested positive, and we can also tell whether they got hospitalized, and also whether they unfortunately died. So out of all of that, if you analyze the numbers, what it tells us is that if you had been previously infected with COVID, if you do come into contact with the virus again, there's about 20 to 25% chance that you will get reinfected. So despite the fact that we're saying between 70 and 80% of people have already had COVID, about 20 to 25% of those people still are at risk of being reinfected. Then there's the other 20% who haven't had COVID. So literally the only way to protect ourselves is through vaccination. What we can see from the numbers emerging worldwide is that vaccination is the absolute best way to protect yourself against both infection, but more than that, and more importantly than that, it's not 100% protection against infection. It is absolutely protection against hospitalization and death. I'm actually in England at the moment. I'm sitting in London. And what we can see from the numbers emerging in the UK right now is that before vaccination, the risk of death from COVID is roughly 8 to 10 times higher than the risk of death from flu, from influenza. After vaccination, given that the vast majority of the population in England has been vaccinated, after vaccination, that reduces to about half the risk of flu. So you can see the contrast. It's a much more risky disease before vaccination. After vaccination, it's basically less dangerous than flu. And what that means is that effectively in a society such as this, where lots of people have been vaccinated, life gets back to normal. And that's really what we should aim for in South Africa as well.